Hi, this is Brian Kim. I want to share with you this case of a pretty standard cataract. That this patient has a lens that as I'm chopping it, the lens begins to do something where it causes me not to be able to chop the lens. So again, I'm not talking about poor technique as far as, ripping the zonules or doing something terrible like that. I'm talking about executing the technique, placing the chopper again underneath the anterior capsule edge out to the equator and trying to chop the lens, and it seems to not work. And so I'm going to show you why does this happen, how to recognize it, and how I'm going to overcome it. So again, remember, those of you who are learning how to do chop techniques, it could be a little frustrating because you try to execute the chop and it fails. In other words, you do the chop and nothing happens. You don't actually fracture the lens. And now this can happen with any chopping technique, horizontal chop, vertical chop, but this can also happen with double chop and cross chop as well. And so I'm going to show you how this happens, why it happens, and more importantly, how can you overcome it? It's really a very simple fix. It doesn't take a lot of effort or time, and you just have to know how to recognize it, like I said, and then more subtly and correctly reposition your instruments to more effectively create that chop. So using a cotton tip to steady the eye, use a corneal marker, which will help me to center and size the rhexis. And I'm turning the eye again with the cotton tip so I can make my paracentesis incision first on the right side and then the left side, making sure I'm flat to the iris plane, which creates a nice corneal shelf, which will allow me to achieve a self-sealing incision. This is intracameral lidocaine and then some intracameral epinephrine, and then now some dispersive viscoelastic to coat the corneal endothelium and flatten the anterior capsule. And this is the triplanar corneal incision. I make a vertical groove with my diamond blade. Place the blade into the deep part of the groove, tunnel through the cornea, and when I'm ready to enter, I turn the eye towards me with the cannula and then I enter. This patient has a little bit of a Bell's reflex. This is the left eye, so I'm using the Orlock technique with the cannula to hold the eye straight, and I'm turning the eye downward, which is towards the left on the screen. I use my forceps to puncture the center, pull down towards me, creating a tear, grabbing the right side of the tear, going around circumferentially. Again, using that cannula to help control the eye as well. You can see great control with this low profile forceps, and then using that cannula to control the eye since the patient's wanting to look upward, which is towards the right of the screen. Finish off the rhexis, burp some viscoelastic out. And this is a capsular fornix hydrodissection technique. I place a cannula under the rhexis edge contra-incisionally, point the tip down, get a nice wave, decompress on the left side, sweeping underneath the capsule and the anterior capsule rhexis edge on the left side, and then doing the same thing on the right side. And then the lens begins to spin here. There's a lot of cortical material and epinuclear material. Lens material is kind of fluffed up, so it's really hard to tell what's going on here. Irrigating the surface of the eye, adjusting the sleeve. Lifting the incision with the chopper, going in with irrigation off to minimize Descemet's trauma. Removing the surface epinuclear material now. You see the chopper position, it's leading off, going under the rhexis edge contra-incisionally, turning the tip vertically around the equator, turning the phaco tip vertically sub-incisionally, fracturing the lens completely in half. Turning the chopper around the right heminucleus, hooking the peripheral lens, pulling it central toward the phaco tip, and fracturing the right heminucleus in half, and that is the cross chop. Using some vacuum to lift that first quadrant up, crushing it between the instruments and emulsifying the lens piece. Freeing up that second quadrant, turning it, separating it, getting around the lens. It kind of turned on me, but I was able to pull it up with some vacuum and then crushing the lens between the instruments and then emulsifying the lens pieces. Grabbing that fragment, lifting it and crushing it between the instruments and then emulsifying the lens piece. So that was the first heminucleus. This is the second heminucleus. Look, see, I'm going to slide the chopper around it. It doesn't chop. I try to go again, and it doesn't chop. So this is what happened. As I'm trying to slide, I want to make sure I'm underneath the rhexis edge. But when I do that, I'm snagging the epinuclear material. So rather than sliding it, it's just catching it. And so I did it one more time, but the same thing happened. So the lens piece actually rolls. It won't allow me to get to the equator. And so that's what happened twice. So now I go around it, and see, I get around the equator, I hook the peripheral lens, and then I'm able to place the phaco tip deep. By placing it deep, I'm able to more correctly align the instrument so it's going to sandwich and crush the lens more effectively. But that's the key, is when I slid it across, I made sure I went a little bit more superficial with the chopper, and it went out to the equator, and then I was able to fracture the lens in half, as you saw there. And then now I have that third quadrant using some vacuum, positioning the lens and the instruments around it and crushing the lens piece, and then emulsifying the lens. And then this is the last quadrant. It's coming out pretty easily, fracturing the lens in half. I'm removing the epinuclear material. It's rather sticky, and then the whole thing pops out. So again, in these cases, when you have sticky lens material, I've noticed when you are able to grab the lens pieces, then the entire bag gets cleaned out. Because again, all of that material was so adherent to the capsular bag, and then when you grab one piece, the whole thing comes out. But again, going back to why it failed, when I slid and I pronated my fingers and I tried to slide underneath the rhexis edge, and I get into the epinuclear material, there's no clear plane. And so when I'm sliding it, normally it just slides through and it goes through a plane, and it allows me to get that chopper out to the equator, around the lens equator. But you saw those first two attempts, that didn't happen. And as I pushed it, all it did is cause the lens to roll. So as the lens rolls, it's not going to the equator, it's just kind of rotating with me as I was trying to go out. And then when I turn it vertical, of course, it's not around the lens, it's on top of the lens. But because the lens rolled away from me, it didn't work. And so part of that is just recognizing when that happens. And when you're pushing the lens, if you see the entire lens piece rolling away from you, then you know that that didn't work. And so you have to make sure you find that plane, or you can go more superficial, making sure you're underneath the rhexis edge. You want to make sure you're definitely within the capsular bag with the maneuvers. But if you are a little bit more superficial, you wouldn't encounter that lens piece. You're able to go over the lens piece and then hook the peripheral lens. And then, as you saw, keep that phaco tip fairly deep, and then the fracture can occur. And so again, these cases are fairly easy as far as identifying and then fixing the problem. But that's exactly what happens. And again, other cases, you'll see me encounter the same thing. Again, we're not talking about poor execution where you're having, the chopper around the bag. I don't ever do that, and don't ever do that, please, because that's improper technique. But even if you do it the right way, what happens in these cases is the lens material is stubborn, or you're not able to find that plane where the chopper will slide out. And again, that's really specific to the lens itself. Some lens pieces allow you to go out, and it just goes to show this was a rather thickened epinuclear material, rather thick, and it just wouldn't allow you to cheese wire through past it with the chopper. And so as long as you recognize that, and you can get a sense of it early on in the case. Of course, with double chop, since the entire lens is there, when you push through it, it doesn't resist because the entire lens is filling up the capsular bag. But when you have just that second heminucleus left, you have so much space. So as you push, the whole thing is just rolling away from you. And so in that context, you're not going to get an effective chop because it's rolling away, and definitely the chopper tip is not around the lens. And so the way you deal with that again is you make sure you're underneath the capsule edge, but you want to stay a little bit higher, not within the lens material, so that it doesn't get snagged on the lens. And then you're able to slide it past the lens, get around it at the level of the equator, and then positioning that phaco tip fairly deep so that it ensures you're able to get around the lens with the instruments, and then you can get an effective fracture and a chop. And so again, this is a fairly soft lens, but you saw it was a very sticky lens, and more importantly, the peripheral lens material is rather sticky and stiff, and it wouldn't allow the passage of the chopper out to the equator on that one occasion you saw with that second heminucleus. But I was able to overcome that. And again, it's just identifying it, understanding it, and all lenses are different. That's the whole point of surgery, is you can't cookie cutter every case. And I was able to get around the lens, fracture it confidently. And you saw otherwise very efficient lens disassembly. You saw how the epinucleus and cortex were all stuck together, and that's pretty typical in these kind of situations. It's because of firm adhesions between the cortex and the epinucleus all to the bag itself. And so that's why it's more rigid and a little bit more of a challenge to deal with. So this is why you get chop failure, and this is how you can identify how to overcome it by, again, positioning the chopper around the lens so it's not getting snagged on the peripheral lens material, hooking the lens at the equator, and then placing that phaco tip deep to fracture the lens. So I hope this was helpful to you, and I thank you for your attention.